Today I'm going to share with you something that 9 out of 10 seniors over 60 know, and it could be silently putting your legs and feet at risk. If you've ever felt numbness, tingling, or unexplained pain in your feet, even just a slight discomfort that comes and goes, this video is for you. Stay with me until the end, because I'm going to show you 7 simple exercises scientifically proven that can restore circulation, relieve pain, and give you your freedom to walk and move confidently again. I'll also explain why most people think walking is enough, and why that advice could actually be hiding these warning signs. Before we start, let's be honest, walking is wonderful. It keeps you moving, it's low impact, and it's recommended by nearly every doctor. But here's the truth, walking alone is often not enough after 60. You might walk every day, track your steps, but still feel stiff legs, shaky balance, tingling in your feet, quick fatigue, and you might think it's just age. But that's a common misconception. The problem isn't time, it's the type of movement your body is receiving. After years of working with patients, I've seen a pattern. Those who stick to walking without targeted exercises often develop nerve and circulation problems, even if they look fit on the outside. That is why today I'm going to give you 7 simple exercises that you can do at home without equipment, and they are specifically designed for seniors over 60. Let me tell you about Mrs. Johnson, a 68-year-old patient. She walked 5,000 steps every day but complained of numbness in her toes and aching calves. After trying the first few exercises I'll show you, within a week she felt tingling reducing, her balance improved, and she even started gardening again without fear of tripping. This is exactly why these exercises work. They activate the muscles, improve circulation, and wake up the nerves that walking alone can't. Exercise 1, seated leg pump. Goal, improve circulation, activate calf muscles, reduce numbness. How to do it? Sit comfortably in a sturdy chair. Slowly lift your heels, keeping your toes on the floor. Lower your heels, then lift your toes while keeping your heels on the floor. Repeat 15 times, do 2 to 3 sets per day on both feet. Additional benefits: improves blood flow, reduces swelling in the feet, activates muscles that store glycogen, helping with natural glucose regulation. Exercise 3, toe towel pull. Goal, improve strength in toes, feet and ankles, activate circulation, reduce numbness. Now, let's move to something a little different. A simple towel or small blanket can make a huge difference. How to do it? Sit on a chair or lie down on a mat. Place a towel on the floor and position your toes on top. Pull the towel toward you using your toes. Start slowly, then gradually increase the movement. Repeat 10-15 pulls per foot, once or twice daily. Why it works: strengthens toes and arch muscles, which often weaken with age, improves blood flow to the front of the feet, helps reduce tingling and numbness over time. Exercise 4, ankle ball squeeze. Goal, strengthen ankles, activate calves, stimulate leg circulation. Next up, we need the same ball you used before. This time, it goes between your ankles. How to do it? Sit comfortably and place the ball between your ankles. Press your ankles together firmly. You'll feel your thighs engage. Hold for 5 to 10 seconds, then release slowly. Repeat 5 to 10 times on both legs. Tips: find a comfortable angle. Don't strain your knees. Focus on steady breathing. You'll notice your legs warming up. That's circulation improving. Exercise 5, lying foot stretch. Goal, full stretch for feet, ankles and calves, improves flexibility and relieves pressure on the lower back. This one is very gentle but incredibly effective. How to do it? Lie down on your back. Lift one leg slightly and extend your toes outward, holding for 5 seconds. Bring your toes inward and hold for 5 seconds. Repeat 15 to 20 times per foot, alternating legs. Why it matters: stretches lower leg muscles and shin area, reduces stiffness in ankles and knees, improves overall foot circulation, helping with numbness and tingling. Let me tell you about Mr. Thompson, 72. He had been walking daily for years, but always complained that his feet were falling asleep. After just a few sessions of these exercises, he said, "Dr. Six, I can finally feel my toes again." Now, imagine that. Just a few minutes a day could bring back a sense of touch and comfort in your feet that you haven't felt in years. And here's what I want you to do. After trying these exercises for a week, come back and leave a comment about how your legs and feet feel. I check every comment because I know these exercises really work, and your feedback can inspire others. So far, we've covered the first 5 exercises, all targeting circulation, strength, and flexibility in your legs and feet. Now, in the next section, I'll show you 2 more powerful movements, plus a bonus stretch that is incredibly effective for seniors dealing with neuropathy, diabetes-related tingling, or general leg fatigue. Stay with me, because these last exercises are often the ones people skip, and they unlock the full potential of your legs and feet. Exercise 6, heel raises. Goal: strengthen calves, improve circulation, reduce numbness in feet and ankles. Now we're going to focus on something that seems simple, but it's incredibly powerful: heel raises. How to do it: stand next to a chair or wall for support. Slowly lift your heels off the ground, standing on your toes. Hold for 3 to 5 seconds, then lower slowly. Repeat 10-15 times, twice a day. Why it works: strengthens calf muscles, which pump blood back to your heart. Improves ankle stability, crucial for preventing falls. Helps with tingling and numbness by increasing circulation. Exercise 7, foot and toe flexion. Goal: activate underused muscles, stimulate nerves, and boost circulation. Finally, let's do a foot and toe flexing exercise. How to do it: sit comfortably in a chair. Lift one foot slightly and curl your toes inward, then stretch them outward. Flex your foot up toward your shin, then point it down. Repeat 10-15 times per foot every day. Why this matters: activates nerves often neglected in seniors, reduces numbness and tingling by improving blood flow, helps maintain joint mobility and overall foot health. Goal: stretch legs, feet, and ankles. Relieve lower back pressure. Here's a bonus stretch that many people skip, and it's a game changer for foot comfort and leg circulation. How to do it: lie on your back. Lift one leg at a time and gently stretch it toward the ceiling. Flex your toes and slowly rotate your ankles. Hold for 10 seconds, repeat 5 times per leg. Why it works: stretches calves, hamstrings, and foot muscles. Helps relieve lower back tension. Let me share another story. Mrs. Davis, 68, came to me frustrated because her feet would constantly go numb during walks. After practicing these 7 exercises daily for just 1 week, she told me, "Dr. Vicks, it feels like I can finally feel the ground beneath my feet again." This is what happens when you activate the right muscles and nerves, even after 60. Here's what I want you to do. Comment below with your experience. Tell me how your feet feel after trying these exercises for a week. Your story could help another senior regain comfort and mobility. Now let's talk about nutrients that make these exercises even more effective. Vitamin D3, essential for strong bones and healthy nerves. Seniors should aim for levels around 70 to 80 mg/ml. Vitamin B12, crucial for nerve health and energy. Ideal levels are around 350 pg/ml. If your levels are low, supplements or dietary adjustments can make a huge difference in reducing numbness and tingling. So here's the plan. Try these 7 exercises daily for 7 to 10 minutes. Monitor how your feet feel. Numbness should reduce, circulation improve. Share your results in the comments and ask questions if anything is unclear. And here's a secret most people over 60 don't know: walking alone is not enough. Without these targeted exercises, circulation weakens, muscles atrophy, and numbness persists. These 7 exercises are your shortcut to regaining strength, stability, and confidence. Remember, it's never too late to start. Even if you've ignored numbness in your legs and feet for years, these exercises, just 10 minutes a day, can change how you feel, move, and enjoy life. Your feet are the foundation of your mobility. Take care of them, and your entire body will thank you. So take the first step today, literally. Start with these exercises and reclaim the comfort, stability, and freedom you deserve. Incorporating these exercises into your routine can make a significant difference in leg strength and mobility, helping seniors maintain their independence and quality of life. If you've made it this far, I'd love to hear your thoughts. Rate this video from 1 to 10 in the comments and let us know what you think of the content. Your feedback is essential for us to keep bringing you useful and relevant information. Don't forget to subscribe to the channel and turn on notifications so you never miss an update. Thank you for watching and see you in the next video.